What's up guys, it's me, Street C, aka the Traveling RDH and your new grad coach with your hashtag Ask a Street C series. Today's question is, what information do I relay to the dentist? So this is kind of like a questionable thing because some dentists want a lot and some dentists want minimal. So it really depends. So it's important for you to establish that connection with your dentist and find out what they want to relay to you. How much co-diagnosis do they really want you to relay? I work for a dentist that he does not want me to say anything in the mouth. I literally just say, hi, Dr. So-and-so, this is my patient so-and-so. Today we did exam, 4 bite wings, fluoride, whatever. I tell them exactly what we did in the appointment. If I found any clinical, not so much clinical findings, but like if the patient had sensitivity on tooth number 7, or the patient had I tell them how much buildup they had, what their home care routine looks like. And then I leave the diagnosing to them. Now, there are some other doctors that would prefer you to help co-diagnose more. So that really is a conversation that needs to be had with the doctor. Now, when it comes to co-diagnosing, I never like to say in front of a patient, you need a filling on X, Y, and Z. I will always say something along the lines of, Dr. So-and-so, I saw something suspicious on tooth 11, 12, and 13. Can you please take a look at it? Or I will create on a sticky note what list of areas that I want the doctor to take a look at. You know, did I see a suspicious area on the x-ray on tooth number 4? I'll say tooth number 4, mesial question mark seen on x-ray. Or if I saw something in the mouth, you know, say I saw an area of recession that is starting to darken, I'll say on a sticky note, tooth number 31, buccal seen on in mouth, you know, dark shadow, whatever I saw. I don't necessarily always like to say things in front of patients because you never want to put your foot in your mouth. So sometimes if you're like, oh, you're going to need a crown on that tooth, and then the doctor comes in and you don't need a crown, it makes it look like either you or the doctor don't know what they're talking about. So I always try and relay certain information in terms of treatment on a sticky note to let the doctor know, like, hey, this is what I saw, but I want you to confirm what you want to do. And like I said, every doctor likes to co-diagnose differently. Some want you to do more and some want you to do less. And that's just a conversation that needs to be had with your dentist that you're working for as to how much information they want you to relay to them and how much information should be relayed to in front of the patient. Now, I always like to confirm what work needs done so that the patient hears it multiple times. So if the doctor diagnosed a crown on 8 and 9 and say a filling on number 23, I will say, okay, Dr. So-and-so, so we're going to be doing a crown on number 8 and 9. I have that in the treatment plan for reason X, Y, and Z. And I also have in the treatment plan number 23, you recommended a filling on, you know, mesial distal due to decay. So that the patient not only heard it once from the doctor when he's going through the mouth, but then he heard me confirm it to the doctor that this is what we're doing. And then after the doctor leaves, I'll say to the patient, is there any other questions that you have about the treatment that needs done? And that gives me the opportunity for them to ask questions about what treatment needs to be done. And it also gives me the opportunity to explain anything that they may not have understood, or that maybe the doctor didn't explain well enough for them to understand. You never want the patient to leave your room wondering what treatment is going to be done, wondering, what the procedure even is. Make sure that you answered all of the questions that the patient has before you let them exit their room. So, long story short, make sure that you discuss with the doctor what kind of co-diagnosis needs to be done so that you know what information you need to relay to the doctor in front of the patient. I hope you guys enjoyed.